Welcome to Alzheimer's disease. This is chapter 15. So you might hear me refer to it as Alzheimer or as Alzheimer's disease. Depending on the resource, the reference, there's kind of varying opinions on how it is supposed to be referred to. So I might go back and forth. I think we can all agree that Alzheimer's disease is pretty daunting, and maybe you have a family member or a friend of a family that has been diagnosed, but realizing how serious, progressive, and ultimately fatal this neurodegenerative condition is very scary. A lot of decisions have to be made for friends and family members that face this disease, as many are going to require long-term care. Early diagnosis, appropriate nutrition, and regular physical activity are important for both a person with Alzheimer's disease and the health of those providing care. And that's a serious thing because those who are trying to provide care for individuals with Alzheimer's disease, it's very exhausting. They really get to a point where they need 24-hour around-the-clock care. And so their health is also very important. While it was once considered a relatively rare disorder, it is now the sixth leading cause of death in the U.S. and is considered a major health challenge affecting more than 5 million Americans, the majority of whom are over the age of 65. The prevalence of neurodegenerative conditions like Alzheimer's doubles every 5 years beyond the age of 65. And as of 2015, it was estimated that nearly 15% of Americans had reached the age of 65. By 2030, in 10 years, when the last of the baby boom generation hits this milestone, 1 in 5 Americans will be over the age of 65. This disease was named after Dr. Alzheimer, and he was a German neurologist and psychiatrist who first described the condition in 1906 when he reported changes in the brain tissue in a woman who had died of an unusual mental illness. Her symptoms included memory loss, language challenges, disorientation, behavioral problems, and hallucinations. Following her death, Dr. Alzheimer studied her brain and described 2 of the primary hallmarks of Alzheimer's disease: abnormal clumps or globs of sticky proteins, referred to as amyloid plaques, and tangled bundles of fibers within the neurons called neurofibrillary or tau tangles. Alzheimer's disease is present years before symptoms of memory loss and other cognitive deficits occur, and this is unfortunate as many are unaware and therefore take no preventative measures to slow the progression of the disease until symptoms start to arise. The presence of the disease without symptoms is referred to as the preclinical stage of Alzheimer's disease, in which people appear to function normally, but a number of toxic changes within the brain are already progressing. For one, the amyloid plaques appear to be more abundant in those with Alzheimer's. These consist of insoluble deposits of beta amyloid, which is a toxic protein fragment found in the spaces between the brain's nerve cells. Secondly, tau tangles, which consist of abnormally shaped or twisted protein collections, stick together and build up, and eventually disrupt cell communication and cause cell death. These toxic changes cause healthy neurons to shrink, lose connections with other brain cells, stop functioning, and even die. Essentially, as more neurons are affected, the given brain areas lose volume and shrink, which appears to initially occur in the hippocampus, a critical area of learning, short-term memory, and conversion of short-term memories to long-term storage in other areas of the brain. If you can, take a moment to watch the descriptive video I've included. Follow the link. I like this video because it really kind of breaks down the disease and explains kind of the progressive nature of it. While Alzheimer's is thought to occur early in life, 95% of the cases are late onset and occur after the age of 60 years. Early onset is thought to be caused by gene changes inherited from a parent, but a smaller number of cases currently have no identified cause. The more prevalent late onset form results from a variety of factors that occur and progress over decades. These include genetic mutations such as the A-lipoprotein E gene, environmental and social factors, and poor lifestyle choices. Additionally, as Alzheimer's progresses, memory challenges increase and other cognitive difficulties are manifested, such as personality and behavior changes, difficulty handling money and paying bills, challenges with multi-step tasks such as dressing and cooking and wandering. At the severe stage of Alzheimer's, people lose their ability to communicate, often becoming completely dependent on others for their daily care, and perhaps requiring admittance to a care facility. Consuming appropriate nutrients and calories is especially important if you're an older adult striving to maintain physical and mental functions, independence, and associated quality of life. Although healthy eating patterns have been associated with a lower risk of cognitive decline, there is no definitive answer yet about the role lifestyle factors may play in reducing Alzheimer's disease risk. The strongest evidence so far suggests that what's good for your heart also benefits brain health. Memory loss in Alzheimer's disease is linked to the abnormal clumping of protein in the nerve cells, causing them to malfunction and die. The presence or absence of vascular disease may explain why some people develop characteristic Alzheimer plaques and tangles but do not develop cognitive decline. The role of atherosclerosis in the development of cognitive impairment and dementia may be related to the degree of atherosclerotic calcification in the brain. Evidence indicates that while total fat intake is not a key factor in brain health, eating healthy fats and less saturated fat may help protect the brain. Most of the fat consumed should come from unsaturated fat food sources such as fish, nuts, and vegetable oils. Omega-3 fatty acids, monounsaturated fat, and polyunsaturated fat are considered heart-healthy fats as well. Both the dietary approaches to stop hypertension, DASH eating plan, and the Mediterranean diet have been found to help reduce heart disease and may also lower dementia risk. The Mediterranean diet typically consists of plant-based foods, seafood, and olive oil while limiting the intake of red meat, sweets, and eggs. The DASH eating plan is lower in sodium than the typical American diet, and it limits the intake of saturated fat while emphasizing foods rich in potassium, calcium, magnesium, and fiber. Researchers from the Rush University in Chicago combined elements from the heart-healthy Mediterranean diet and the DASH diet to create what is known as the MIND diet, or the Mediterranean DASH Intervention for Neurodegenerative Delay. The Rush Memory and Aging Project found that people whose diets most closely conformed to the MIND diet had a 53% lower risk of developing Alzheimer's. Participants who had moderate adherence demonstrated a 35% reduced disease risk. This diet focuses on 10 brain-healthy foods and 5 foods to limit to avoid brain drain, and you can look at those there in Table 15.2. For years, type 2 diabetes and Alzheimer's were thought to be independent disorders. However, evidence now suggests that having diabetes increases the risk of developing Alzheimer's disease and that insulin resistance may contribute to amyloid deposition in the brain. Even among people who do not have diabetes, higher blood glucose levels have been associated with a greater risk of dementia. The results of these studies reinforce the importance of achieving and maintaining optimal levels of blood sugar. Here's your brain break. Okay, so let's take a look at some of the nutritional supplements that may or may not help prevent the progression of Alzheimer's disease. The National Center for Complementary and Integrative Health reports that there is no convincing evidence from a large body of research that any dietary supplement can prevent the worsening of cognitive impairment. For example, a recent research review found no convincing evidence that vitamin E is of benefit in the treatment of Alzheimer's disease or mild cognitive impairment, although some studies suggest that consuming a diet rich in vitamin E and vitamin C may be associated with a reduced risk of Alzheimer's. So here's kind of the important piece when we're talking about these supplements is that there's not a lot of evidence suggesting that these supplements can prevent Alzheimer's, can reduce Alzheimer's and symptoms once they have already started. Once that disease is already progressing, there's not a lot of research saying that it's going to prevent the worsening of that cognitive impairment. But some of the research is being linked to perhaps reducing the risk of Alzheimer's. So before that impairment has even begun, preventing the buildup of those amyloid plaques and the tau tangles. This is what we're focusing on with many of these research studies. Studies have demonstrated an association between vitamin D deficiency and an increased risk of Alzheimer's disease, and this is something that we have talked about before in class. And this is going to be common among older adults due to the reduced sun exposure and their skin's decreased ability to synthesize vitamin D. While there appears to be a link between vitamin D and the development of Alzheimer's, more research is needed to determine the actual cause and effect relationship there. Increased intake of omega-3 fatty acids, such as DHA, found in fish, may also be beneficial, or may also have beneficial effects on brain function. The anti-inflammatory effects promote cardiovascular health and may also be beneficial to the brain. However, research in relation to dementia risk has yielded mixed results, so there's not yet enough sufficient evidence to recommend DHA or other fatty acid supplements to treat or prevent Alzheimer's disease. Certain B vitamins such as folate, B6, and B12 have been shown to lower homocysteine levels, and this is an established cardiovascular risk factor. It's a protein, and this research is leading to the hopes that supplementation may prevent or halt the progression of Alzheimer's. However, studies generally have not reported improvements in cognitive performance. And then resveratrol is a compound found in red grapes that has both anti-inflammatory and antioxidant properties, and has been correlated with a lower risk of dementia in a small number of cases, but this is also still being explored. So it's not to rule any of these out, it's just to say that there's not a lot of confounding evidence yet that actually proves any of these to be a significant source of prevention. Regular physical activity improves attention, focus, and academic performance in children. This is something that you guys already know. And the benefits identified include delaying the onset of dementia, decreasing the chance of developing Alzheimer's, and slowing progression in those diagnosed with the disease. Numerous scientific research studies have analyzed the relationship between physical activity and the risk of developing Alzheimer's disease with aging. The findings have consistently shown that people who regularly exercise, which would be 3 or more days per week, had slower rates of cognitive decline and were less likely to develop full-blown Alzheimer's disease than those who experienced less. Moreover, in a study in which daily physical activity was tracked, this actually included gardening, cleaning, and cooking, those with the highest activity had a 2-fold decreased risk of developing Alzheimer's compared with the most inactive individuals. So kind of comparing those individuals who are outside, being active, they're still cleaning, they're still cooking. Keep in mind these are older individuals who are still very independent versus individuals who maybe spend the majority of their day watching TV and popping something in the microwave to eat for dinner. While studies like these suggest an association between physical activity and Alzheimer's disease, they do not definitively show a true cause and effect relationship, nor do they reveal why certain benefits might actually occur. Similar to the effect that cardiovascular disease has on blood flow to the heart and vasculature, atherosclerotic cerebrovascular disease affects blood flow to the brain. Physical activity is an important intervention for the risk factors associated with cardiovascular disease and thus Alzheimer's. By keeping your heart effectively pumping and the arteries serving your brain functioning properly. Because physical activity may stimulate the development of additional cerebral blood vessels or capillaries, they provide key chemicals and nutrients that help maintain the brain's network connections and also induce the growth of new connections that are vital to cognitive abilities. Perhaps the most extensively studied brain chemical is brain-derived neurotrophic factor, also referred to as BDNF, one of the chemicals that stimulates neurogenesis, or the growth of brain cells, and also new synapses. It also increases the release of neurotransmitters and may provide a protective factor for existing brain cells against the toxicity resulting from the development of amyloid plaques. Numerous animal and human studies have documented increased levels of BDNF following both long-term aerobic and short-term vigorous exercise training. In middle age, the hippocampus decreases in size by 1 to 2% every year, and over time this shrinkage can affect memory and other cognitive functions. Regular aerobic exercise can slow this atrophy process and even promote neurogenesis. In research studies, the primary difference between the brains of people with and without manifestations of symptomatic Alzheimer's disease was their brain size, particularly of the hippocampus area. Preservation of brain size or cognitive reserve might allow the brain to maintain its function by recruiting alternate brain networks or connections that have developed over time. Exercise appears to be one mechanism that stimulates this preservation process by stimulating brain chemicals such as BDNF, blood flow enhancements, and other factors that preserve hippocampus volume. People diagnosed with Alzheimer's should remain physically active for as long as possible. One of the pivotal challenges in Alzheimer's disease is the progressive decline in physical function and mobility. When exercise is stopped, the resulting loss of physical fitness really places them in a progressive downward spiral that negatively affects their muscles, bones, and physical capabilities. As cognition and physical fitness progressively worsen, depression, inadequate sleep, and mood changes become more apparent. Daily living functions such as getting dressed and undressed, bathing, preparing meals, and transferring from one place to another becomes very challenging. So exercising and staying physically active is critical to really slowing down this downward slide and maintaining independence and quality of life for as long as possible. And I think I have mentioned my husband's Grandma Margaret before, and I refer to her a lot because Grandma Margaret has dementia and a very progressive form now, probably Alzheimer's disease, although they're not going to diagnose that at this time. But she's 91, right? So she's up there. But after her stroke, and the stroke with the dementia has really changed her capabilities. And what we're seeing a lot lately is definitely those mood changes. She's become more and more dependent on other people, and so her physical fitness has progressively worsened, and she's not always sleeping very well. She can be happy one second, laughing, and then she'll just be cursing at people the next for no apparent reason. And a lot of that is just the sheer confusion of not always knowing exactly where she is or exactly who's with her. And so I've just been able to witness this disease kind of firsthand. And it's very, very scary. And it's sad because it's a rare day now where she recognizes her children even. So again, going back to one of those first slides when we were talking about the importance of self-care for those individuals, taking care of an individual diagnosed with Alzheimer's disease is huge because they are truly dependent and they will suck all the energy out of the caretakers because they're essentially, it's like taking care of a child, although you cannot discipline the child because the child does not, there's no understanding. So you can't discipline, and you just have to figure out how to communicate in a way that keeps that individual feeling safe. Many community centers and fitness facilities actually have specific programming for people with dementia and Alzheimer's, and definitely care facilities, right? They have physical therapists, occupational therapists, they have speech therapists. So these individuals will, if in a care facility, are going to have access to several therapy modalities to help them to live as best they can, have the best quality of life. But there's definitely other resources for those who are still a little bit more independent, and that would be medical fitness centers or YMCAs. And they do have trained fitness professionals who can assist with developing an appropriate program, and they also provide instruction on technique and make modifications as necessary. And a few things to consider are listed here. So check out all workout areas and home environment for potential safety hazards. So if you are possibly going to have them doing any physical activity, exercising at home, you have to check those things out. Keep it simple, especially as Alzheimer's progresses and memory becomes more impaired. The more you load them up with, the more confused and the more frustrated they become. So simple tasks. 3, if balance is an issue, installing and exercising within the reach of a grab bar or assistance should be considered, and definitely in other locations as well, where they have a task at hand. So obviously going to the restroom, or if they're bathing, showering, even maybe perhaps help getting in and out of chairs. Number 4, choose activities that are enjoyable. The key is to remain physically active for as long as possible. You're going to keep their attention longer if it is something that they are interested in. So, for example, Grandma Margaret. Grandma Margaret loves horses, grew up riding horses her entire life. So anything to do with a Western or horses or anything related to that, she is going to enjoy it. 5, walking is an excellent activity and does not require complicated equipment. That's true. You just want to make sure that when walking with the individual that it is on level ground. So walking on gravel is going to be more difficult. If you're walking on an uneven surface, even grass sometimes is kind of hilly or has holes. Those are things to look out for. 6, some form of resistance training should be incorporated. This can be very simple things, right? It could be lightweight, or it could be an ankle weight strapped onto legs. It could be resistance bands. We want that resistance training to be included. 7, start slow. Even 10-minute sessions spaced throughout the day are beneficial. This is even true for beginners of any exercise form, correct? And 8, as ambulation becomes limited, seated exercise activities can be incorporated. Example, Grandma Margaret is pretty much wheelchair bound now. She is strong enough now to get herself out of the wheelchair and into another chair, for instance, but she's pretty much in her wheelchair, and so her exercises are now more focused on her position in that chair. And there's a lot that can be done just within a wheelchair. 9, establish a calm and soothing environment that is devoid of loud noises and distractions. That's true. This is a time where you don't want to have the TV on. You don't want to have those distractions. If there's kids around or anything else that's going on, it's very easy for them to get distracted. Again, it's kind of like a child. Like if I'm trying to have a conversation with my 5-year-old and her favorite TV show is on, or her favorite movie is on, she's not going to hear anything that I'm telling her. So I see the same to be true with Grandma Margaret. If the TV is on, she's going to be plugged in to the TV. She's not going to be in tune with what anybody is talking with her about. So those are just some considerations. Again, this isn't a super long chapter, but it's a very important chapter, as a lot of these, I think, towards the end of the book are very important chapters, because they're things that you are going to start to see if you already have not been seeing, just because of the American way of life and things that happen as we age. So take some time and read this chapter, and make sure you stay up to date with your quizzes. And I hope you're taking care of yourself, and I hope everything is going really well for you. All right, we'll talk to you later.